Hi everyone, my name is Ashley Clarke, and I am a second-year master's student at the University of Calgary from the Department of Surgery in the Division of Orthopedic Trauma. My supervisor is Dr. Prism Schneider, and I am here to present my poster today titled Prolonged Hypercoagulability Occurs Following Pelvic and Acetabular Fractures as Defined by Serial Thromboelastography. Major orthopedic fractures are an independent risk factor for the development of blood clots, also known as venous thromboembolism or VTE, which can be potentially life-threatening complications. Patients with pelvic and acetabular fractures are reported to have the highest incidence of symptomatic VTE with an occurrence of 12%. Currently, there are no recommendations regarding the duration of prophylaxis specifically for pelvic and acetabular fractures, as guidelines right now are based off of hip fractures. So the purpose of my study is to determine the duration of hypercoagulability for these patients by utilizing thromboelastography, or more simply known as TAG. TAG is a whole blood point of care test that provides an accurate and near real-time picture of the changes in blood that occur from clot formation to lysis. A specific value that I'm focusing on, which comes from the TAG analysis, is called maximal amplitude, or MA, and it is a measure of the strength of the clot, and values greater than 65 can be used to quantify hypercoagulability. This is a prospective cohort study of adult patients with surgically amendable pelvic and acetabular fractures that are admitted to Foothills Medical Center here in Calgary, which is a level 1 trauma center for Southern Alberta. Here I've listed our exclusion criteria, which include some conditions that are known to put individuals at risk for VTE, as well as those with known bleeding disorders or already on therapeutic anticoagulation. As you can see in table 1, this is the schedule of the blood draws for TAG analysis. We take blood upon admission, post-operatively on days 1, 3, 5, and 7, or upon discharge from hospital, whichever comes sooner, as well as during follow-up appointments at 2, 4, and 6 weeks, and lastly at 3 months post-operatively, which is the end of our study time point. Of note, VTE events is also considered a study endpoint. Our site has also agreed upon using standardized prophylaxis for this study, and patients are being treated with low molecular weight heparin for 28 days. Okay, here we are at our results. Table 2 shows patient demographics and baseline characteristics. And here you can see we had a total of 17 patients, with 3 being female, with relatively equal split between pelvic and acetabular fractures at 9 and 8, respectively, as well as patient smoking status and if they have comorbidities. Of our 17 patients, 3 had VTE events. All 3 were acetabular fractures, and all 3 were males. Figure 1, I'm just gonna make it a little bit larger for you. Right here, and move my face right there. Okay, figure 1 shows the mean maximal amplitude values upon admission and over the study time points for the 3 patients who developed VTE are in yellow, pink, and red, as well as the average of the other 14, and that's in blue, all of whom did not develop the VTE. Now, the dashed line that goes across at 65 is that MA threshold that I previously mentioned, and anything above that line would indicate a hypercoagulable state. In the figure, you can also see the time points where the data stops for those 3 VTE events on post-op day 1, 5, and at 4 weeks, as that was when the VTE event occurred, and those patients reached their study endpoint. You can see that the average MA values peaked on post-op day 7 and remained elevated until the 4-week follow-up time point. 2/3 of patients were hypercoagulable at that 4-week time point, which is also the time that prophylaxis is stopped. And more than 30% of the patients were still hypercoagulable at 6 weeks, and nearly a quarter were continued to be until the very last study time point of 3 months. For a breakdown of the hypercoagulability at each time point, you can also see it in our table 3 here. All right. Now, what we're finding from the study is that there is a substantial number of patients that are still hypercoagulable at and after the time when prophylaxis is stopped, that 4-week time point. In the study, we have had a low rate of loss to follow-up, with only one patient not being able to complete their last follow-up time point. Unfortunately, that was due to the COVID pandemic. However, despite it being a small sample size, based on this evidence, a future larger study could be performed, which could lead to clinical recommendations regarding the duration of prophylaxis in this high-risk population. Thanks.